So there are three main type of strokes: PCA stroke, MCA stroke, and ACA stroke. How to localize which type of stroke the patient got, just to see how the patient presented. For example, if the patient comes to you with the weakness of the right upper limb, how will you identify that which type of stroke the patient got in the brain? Is it MCA, PCA, or ACA? If the patient comes to you and he cannot talk, he cannot speak, there is a aphasia, how will you identify is it PCA, MCA, or ACA? So we will figure it out this. Okay, so come here. So there is PCA, MCA, and ACA stroke. So to remember it easily, you need to make a diagram of a person here. So this is the face, and make eyes for the face like a P shape. Okay, so this is for PCA. If the patient got a PCA stroke, there will be the symptom of homonymous hemianopia. And in this condition, what happens to the patient is loses its visual field of the one side. For example, if there is a right side PCA, there will be the visual field. For example, this is the visual field, and this right side of the field will be dark for the patient. Patient cannot see in this visual field. Patient only can see on the left side of the of his body with eye. So this is homonymous myopia. Okay, so after this there is MCA stroke. So for the MCA stroke, you need to draw a mouth for the patient, and another M like this. Okay, so it represents, if there is MCA, there will be something related to the patient's mouth and the patient's upper limb. So come to the both side of the brain. If there is left side MCA, as we know that left side of the brain is dominant brain. So if this side of the brain will be affected, there will be a right side of upper limb will be weak, and there will be sensory loss, and along with this there will be aphasia. That patient will feel difficulty in speaking or understanding some related to the Broca's or Wernicke's after the damage. So this M represents this. Okay, so if the patient got the right MCA, and right side of the brain is the non-dominant brain, so in this condition there is obviously the left side of the upper limb will be weak, and or sensory loss will be there, and along with this there will be no aphasia with the right side MCA. There will be the condition called as hemi-neglect. So what happened in hemi-neglect is patient is start neglecting his left side of the body, and in some severe cases the patient assume that the left side of the body is not his own, maybe it's somebody else. So there are some cases reported for this. Okay, so this is all about the MCA. Okay, now comes to the ACA. ACA, for this you need to make the legs of the patient, and obviously there will be contralateral side of the lower limb will be weak, or there will be sensory loss, and along with this there will be the symptoms of urinary incontinence in the patient.